We're at an interesting point in time for sickle cell therapeutics. A couple of years ago, we thought we were doing great. We had our old standby hydroxyurea. We had Adakveo from Novartis. We had Oxbryta from Pfizer. We had another drug called Endari. And things have stripped those drugs away from us, sadly. Oxbryta was pulled from the global market. Adakveo, while still FDA approved, has been pulled by the EMA, and providers here don't really know who to use it for. And the reason for this kind of downturn of fortune is that we were trying to do a one-size-fits-all for therapeutics for sickle cell, and that's not appropriate. Sickle cell patients are so unique, and what drives their disease is individualized. And so for some, it may be a really stiff cell. For others, it may be a cell that polymerizes at high oxygen levels. For others, it may be a very sticky cell. And so the reason these drugs are failing is that the therapies are very targeted to a specific part of sickle pathophysiology, but then they're being given to everybody without looking to see whether that's what's actually wrong or the major driving force in abnormality in that person's red cell. So devices like the MIRCA will need to be included in clinical trials so that we can see in this type of persons with this type of red cell who is going to respond to this drug. That could have saved Novartis's drug Adakveo had they done an analysis like that. Instead, they wanted it to be a drug for everybody with sickle cell, and it seems like it only works in 30%. But because they didn't include red cell function testing like the MIRCA, they don't know who that 30% is, and they can't design a trial to identify them if they don't include these functional biomarkers. So this is going to be the way for us to stop having our drugs fail. When they, pass through their, phase 3 status and try to then go out into the larger sickle cell community. It'll be the way that we can determine when we've achieved a full cure with gene therapy, when we fully corrected the red cell, and can be able to then tell patients that gene therapy is truly curative. So this will be how we really impact sickle cell, bring precision medicine to these patients that need it more than anyone else because they have the greatest variability and need to have the right therapy for the right person.